This is Dr. David Albert at the Digital Health Summit here at CES 2019, and I have the pleasure of talking with Laurie Orlov, who's the founder of the Aging in Place Technology newsletter, Technology Watch, that I've read for years now as an interested participant in this area of taking care of people at home. Laurie, what brings you to CES?
Well, I come every couple years to see what's new in technology. That's probably a prime reason. My second reason was I was on a panel yesterday in the Digital Health Summit about the future of voice technology and its potential to change our lives. And my particular area of interest in that is changing the lives of older adults.
I think that's absolutely right. You know, I think we all see the potential for those seniors living alone, which is a high-risk environment, that maybe Alexa becomes their best friend,
Yes.
and that the opportunities that AI and voice technology might bring could well improve their lives in a variety of ways. So have you, obviously home monitoring, wearables, digital health, smart shirts, smart underwear, all of these things, all these new, I would call them senior-focused technologies, although I'm not sure the companies here understand that that's who would need them. Have you seen anything that excites you?
I've seen some interesting technology that can be done with small sensors, motion detection, the ability to connect that to data analytics, to predict behavior changes before they happen. I think that's probably the most interesting thing that we're ready for now in terms of technology, is to collect the data from sensors, from cameras, and from whatever, put it somewhere, and figure out what it means.
Well, so what you're telling me is the time is finally right for quiet care to have their vision realized.
Yes, 2007.
Exactly. A little, there's a saying in Silicon Valley, to be early is to be wrong. I think they were a little early on the technology wave in the home.
Right.
But, today people have, whether it's Alexa or Google Home or whatever, technology is integrated even into seniors. We at AliveCore, the average age of our customers, 61. So it's not exactly the 30-year-old trying to stay fit. So I think, this is a trend, and I think, do you see it continuing do you see seniors accepting technology at a greater level than they did, say, 5 or 10 years ago?
I do see that. A couple of things have happened in the way of trends that are pretty important. A lot of face-to-face opportunities for seniors are in the process of being eliminated. The idea that you would go to a Social Security office and interact with them, or that you would go to buy a savings bond, or that you would bank in a bank. So those kinds of interactions are fading away. At the same time, technology is becoming more accessible, but I would say the most accessible technology today is voice-enabled. And what we're going to see soon, we have at least one company in this space now, proactive voice. So the idea of proactive voice is where the technology wakes itself up and says, "Did you sleep okay last night?
Have you taken your medicines this morning?
Have you taken your medicines this morning?" This, I think, is probably one of the potentials, and then integrating it with the data about you.
Oh, that's right. You haven't opened your refrigerator.
Right.
So it's time to eat breakfast.
Yes.
I get that, and I think those are all very helpful. Again, aging in place, aging in the home. I've talked to people this morning about hospital in the home. The operative word there is home.
Home.
And, having... none of us are getting any younger.
No.
And we boomers are aging every year. So I think this applies to more and more of us, and will be important to enrich our lives, not just improve our health.
And I think it's key to understand how long we're going to live. So a lot of people think that life expectancy just shortened. That is not the case at 65. So if you make it to 65, women on average are going to live to at least 88.8 and men to 86.6. If you make it to 80, you're going to live another 10 years minimum.
That's exactly right. those statistics were brought down by opioid deaths,
That's right.
overdose, and most 65-year-olds
Five-year-olds
are
are not
addicts.
opiate.
No.
They're not addicts.
Well, this has been wonderful. Thank
Okay.
you, and I'm glad you're. Please keep educating us as to what's the latest tech for aging in place.
All right. I'll be
This-
happy to do that.
Thank you. This has been Dr. David Albert at the Digital Health Summit of CES 2019, and I've been talking to Laurie Orlov from the Aging in Place Technology Watch, hosted by Living in Digital Times. Thank you.